left arm goes behind her. All right, so I said forward torsion. I said I couldn't remember what we were doing, so everything went forward. That's how I remembered it. So I'm going to roll her shoulders forward, and I'm going to bring her knees up. Okay, so now why am I doing this becomes the question. Okay, and then I said her feet were going to push towards the ceiling. And when she relaxes, I'm going to let her feet go towards the floor. Okay, so let me just go over why we're doing that first. Okay, we said it's a left sacral torsion on a left oblique axis controlled by the right piriformis. So the right piriformis is here, right? Right piriformis does what?
Externally rotates.
Okay, so when I drop her feet down, what does that right leg in?
Internal rotate.
Yes, so when she pushes up, I'm going to be contracting the right piriformis, okay? So I'm going to be directly inhibiting it. So that's just a little hint for you right there, because you could reciprocally inhibit it if it's not working. When I'm saying you could be a thinking therapist, but let's stay with this one first. Okay, if the sacrum is left, what can't it do? It cannot go to the right. That's what we call its motion restriction, okay? So its position is it's left on left. It cannot go to the right. When my lumbar spine turns to the left, what does that facilitate in my sacrum?
Right, sacrum.
Okay, so I have her lying on her left side and dropping her right arm over the table. So what am I creating? Left rotation of the thoracic and lumbar spine. Okay, so that's going to help me bring the sacrum to the right, and that's why I have her in this position. And then I'm going to directly inhibit the right piriformis. Okay, so now I'm going to turn around. All right, you go, please. So now I'll show you what you palpate like. Always working in clinics that have high-low tables. Otherwise, you won't have a back if you work clinically for as many years as I have, which is 32.
But who's counting?
But who's counting? Well, I like being a clinician, you know. Most people don't last this long. I don't know if anybody, we talk about that. We don't think anybody, we're taking bets, we don't think anybody in your generation is going to last this long. Prove me wrong and treat me when I'm 80, okay? And treat me well. That's my challenge to the next generation of PT students. Treat me like I treat my 80-year-old people. One at a time, and like we make a difference in the world still. Okay, so what I'm doing here is I'm finding my L4-5 interspace, and then I'm going down to L5-S1. And if you haven't done a lot of this, then what you want to do is bring the knees up until you hit L5-S1, and then maybe go past it, and then come back a little bit. And when we come around to help you with the lab, make sure that we have you feeling the right spot, okay? And that you feel like, oh yeah, tension on. Did you see Karate Kid? Are you too young for that? Wax on, wax off, wax on, right? Tension on, yes. Tension off, right? Okay, so you want a little bit of tension, but you don't want so much tension on that you can't create change. And you don't want to be in the segment above it, okay? Because we're really trying to change L5 on S1. Okay? So then I have her roll her shoulders forward a little bit until I feel a tension there, and she's past it, so I can let her roll her shoulders back just a little bit. So now again, I've taken up, we talked about barriers. Did Phyllis talk about barriers? So we have 3 barriers. Flexion extension was the first one I did. Rotation with her trunk was the second one I did. And then I'm going to do side bending. And that's going to not take as much because Freya's third law said when you introduce motion in one plane, it reduces motion in the other planes. So when I first started doing these, I used to be way down here. And I'm going, wow, this technique is really hard on me. I was so far past my barriers because I was young. Anyway, so don't make those same mistakes, okay? So I've got her there. And then I just say, can you press your feet gently towards the ceiling? Or what I should say is meet my resistance. Because if you say push, guess what they do? And then you've lost your barrier, okay? If you say, this is only a gentle technique, just meet my resistance, and then they press a little bit more, please, then you get it right to the tension that you want, right under that finger that's at L5-S1. Hold it for 6 to 30 seconds, is what I have been taught, and relax. And then they take a nice deep breath, and they blow it out, and when they relax, you bring the knees up a little bit more to the next barrier, so a little bit you'll feel a little bit of tension, and then you back off. Let her shoulders come forward if she needs to anymore, and then I let her feet down a little bit more, and then hold up again. So wonder if she can't take one of these motions. Wonder if she says, bringing my knees up really bothers my back. You don't have to start with that one. You could start with side bending first, and then you could introduce rotation second, and then maybe you only need a little bit of flexion, and you can still use the technique. And if we have time, I'll even show you how to do it sitting, okay? Because sometimes that's most comfortable for people. That's kind of a fun technique, okay? I'd like to do them one at a time. Is that okay?
That's fine. So a couple things.
Yep.
So
Thanks.
Can you show this one, just show it on Kathy? I want you guys just to look at how her hand placement comes over the top of the feet, like that.
Oh, yes. I'll show,
And
yeah,
look
how
at how
I,
she's resting the patient's legs on her
Yes,
thighs.
yes.
Biomechanically,
yes, you do need a
makes this
stool.
look so easy.
I do have a stool. Trust me, when I'm at work, I do have a stool. Or I would say, all you women who've done lots of sit-ups, too bad. I've got a little too much speed bump that I've always had since I was your age. You can just put it right there, no problem, okay? Like, flat stomachs are overrated. You videotape that? That's good, yeah. Put it on YouTube, and some people tell me I'm funny. I'm trying to be discovered, you know?
Note Shirley's position, because again, she makes it look very easy and you kind of don't pay attention to that. But look
That's
at how
right.
she's supporting the legs like this.
So she has to feel relaxed, or you won't get a good result, number one. You have to feel relaxed, or you'll be going, oh my God, I'm never going to make it through 12 patients a day at the end of the day, okay? And as old as I am, I can make it through 12 patients a day.
Now, the other thing is, how do you know that that the patient is giving too strong of a contraction?
Because she moved me out of my barrier.
Okay.
So I'm asking her to hold right there until I feel just a contraction underneath that finger. I don't want to feel under the one above it or the one above it, or when I said to her push, and she did, go ahead and do it again, Kay. And she pushes, now we're having a battle, and none of us are going to win, and she's all over the place recruiting all the wrong muscles. It's really about, what I learned early on was it's really about recruiting the right muscles, and then you get the right result. If you recruit too many muscles, you're going to not change the structures that you want to change. If you've done your differential diagnosis well, and you know it's a left sacral torsion, and that's what you need to treat, then that's what you need to treat. You don't need to treat the whole lumbar spine by having a push that hard. Does that make sense? Okay. Is that
And
right?
the other point I was just going to make is also after the patient contracts, she's taking up the barriers in
All
three different planes.
I bring it into a little more flexion, I have her rotate a little bit more, and I drop it to the floor a little bit more. And I have them breathe, because you know what? And I breathe too. My mother said the key to living is breathing. She was a smart woman. Listen to me, mother. Okay. So anyway, it's true though. But then you're not tired by the end of the day if you're not holding your breath and your blood pressure's not going up. And then they're making sure they relax when they take a breath, and you get a better result. Okay. Really, you know, like the nice thing about muscle energy is I might only have to do 2 or 3 different muscle energy techniques in a session, and then I go out and do other things that I want to do. I use Mulligan, I use myofascial, I use strain, counter strain, I use visceral, I use cranial, and I do a lot of strengthening and conditioning with my patients because I'm a CSCS also, and a PT, which we need to do. But I want to fine-tune whatever segments I don't think are working properly so that my exercises are effective. You know, I used to think when I was your age that exercise could get better. Then I had a bad car accident and was stuck. And I was in the pool every night, swimming, and my back just wasn't getting better. And then the osteopath who I learned with treated me, and this segment went, oh,